Hello again. Today we'll penetrate a new era. We will answer the question of when to start with skincare. So we have to announce our expert for this episode, Dr. Akreti. Welcome on board.
Thank you so much for inviting me on this forum. It is lovely to interact with you. Let me introduce myself. I am Dr. Akreti. I am based out of Dubai and I have my own clinic called Athena Dermatology Clinic. I have over 10 years of experience in the field of dermatology.
Great. Based on this wide experience, we are sure it will be a very valuable insight for all of us. So let's start from the first question. From a clinical viewpoint, doctor, is there a specific age or developmental stage that markets the ideal time to start basic skincare regimen or routine?
So skin is the largest organ of our body, which is always exposed to the external environment since birth. So the answer is that we start skincare routine from day one of life. We apply the moisturizer, the sunscreen, we have the baby products, we have the teenage products, we have the mature skin products. So we have the range of everything and we start skincare from birth.
Great. Let's have to another section. Here to highlight the question. Can you elaborate on the physiological changes that occur in the skin throughout our lifespan and how these changes influence our skincare needs at different ages?
Okay, so talking about the physiological changes, at birth, the skin is very, very sensitive, very new, not exposed to the environment at all. As the baby grows for the first 2 years, it is exposed to everything and it learns to be capable of protecting itself, so forms its own external immunity. At that age, we usually get eczemas, which is most common in babies. Some children have lacking of barrier control in their skin and that goes into eczema as they grow slightly older. By the age of around 8-9, there is a change in the skin lining again. We have oil production, so oil glands take over and it is pre-adolescent skin type. So suddenly there's too much of oil and acne pop up. So this happens in about the teenage years from 13 to say about 18-19. And again, at that age, when we enter into our mid-20s, it matures to become an adult-like skin. With all of this, if there is too much of sun exposure, over the period of time, there is loss of collagen, loss of elastin. So we start getting fine lines, wrinkles in our early 20s and 30s. As we grow older in our 40s with the loss of collagen, we get saggy skin. And by 50s, we all know that everybody has sagging skin and deep lines.
Great. So, Dr. Akreti, what are the evidence-based topical and systemic approaches used to teenage acne and how these strategies integrate with the basic skincare routine?
So, teenage acne is a very large and varied topic because it depends on the type of acne that we have. And acne can be divided into 4 grades. Grade 1 is just blackheads and whiteheads. Grade 2 is red colored lesions. Grade 3 is pus-filled lesions and grade 4 is cystic lesions. So if we start from grade 1, usually topical retinol based creams really help in sort of exfoliating the skin and declogging the skin. Grade 2 is the red top ones where some amount of inflammation is there. So a topical antibiotic is required along with the retinol. Grade 3, definitely it's pus filled. So we do need to give oral antibiotics over here. And grade 4, where nodular cystic, the best result we get is with oral isotretinoin. Again, a oral retinoid. So up until grade 3, we use topical retinoids, but in grade 4, we use oral retinoids.
Great. So, Dr. Akreti, can you discuss the impact of UV radiation on the skin and the role of sunscreen as a fundamental preventive measure across all ages?
Now, UV exposure is there since birth. So, sunscreen application should be there from childhood onwards, which most of us fail to understand that whatever sun exposure happens is always harmful exposure. So, we should make sure that we protect our skin. Now, there are 2 types that affect UVA and UVB. UVB, which is the primary source that we get mostly, this is more superficial This can cause a bit of changes in the skin lining and cause wrinkling, loss of collagen and elastin, and it also causes carcinomas or skin cancers, superficial or deep. Now, UVA usually penetrates a lot deeper into the skin, and that reduces a lot of the collagen and elastin. So, UVA is directly responsible for photoaging, as we may say. And both combined together causes pigmentation, causes freckles, fine lines, deep wrinkles, loss of collagen and elastin, and of course, sunburn as well. Now, when we apply sun protection factor 30 or 50, 30 and above, I would say 30, 50, 60, 80, anything above 50 doesn't really matter because the protection value is almost the same. So the idea here is that a sunscreen is more important.
Great. So, Dr. Akreti, can you explain the mechanism of underlying aging signs? How can topical products like retinoids and antioxidants affect these processes?
Okay, so as I just mentioned that UVA and UVB exposure does cause a bit of sort of DNA damage, and that causes the collagen and elastin to become less. Now, we can use topical products like retinoids. We can also use topical antioxidants like vitamin C or coenzyme Q10 that can help in reducing the reactive oxygen species and help in sort of reducing the oxidative stress onto the skin. But this is topical. There are other systemic tablets that are available. Again, these are oral antioxidant supplements which help as an internal sunscreen, as a barrier, so that there is not much damage with the oxidative stress.
Great. So, Dr. Akreti, beyond all topical products, are there any clinical consideration regarding diet and supplements and life health modifications contribute to overall skin health?
Definitely, diet is a very major factor. Starting from early childhood, if a child is lactose intolerant, they do burst out into a rash. So milk is a trigger sometimes. If someone's allergic to seafood, then urticaria is the type of rash that we see. If the child is a little older and too much of sun exposure, they can get some sort of sun allergy. As we move into the adolescent age, acne, there are a lot of dietary triggers for acne. Sugar, lots of preservative foods like chips and cheese and colas, and then as we get slightly older, the more sugar we eat, the more collagen and elastin reduces. So it's the person starts looking a lot older. So diet definitely plays a very important role. Healthy eating, lots of fruits, because fruits have antioxidants, and antioxidants, as we all know, that really helps in reducing the aging damage.
Perfect. So, Dr. Akreti, why is clinical evaluation by dermatologists very crucial for developing a skincare routine, especially for individuals with specific skin conditions?
This is a very great question, and not a lot of people understand that why is it important to see the dermatologist as their physician. Because if we see, marketing gimmicks are there and a lot of companies are selling a lot of products saying that theirs is the best. But is it best for your skin is the most important question. And that only a practical person who has studied dermatology can tell you what is your skin type. Most people are confused. Is their skin type oily, combination? Do they have underlying eczema? Do they have psoriasis? Do they have seborrheic dermatitis? Now, if they have any sort of rash and they use the wrong cream, the rash only increases and exacerbates and damages the skin more. A lot of products, over-the-counter products, have topical steroids in them where they are not even mentioned in the back. So people start using them, they see some result, and then they use it for many years and their skin becomes thin, it bruises easily, it does not heal properly, and all that renders to a poor skin health. So the best way to go with a good skin routine is to go to your dermatologist and understand, get your skin analyzed and see what it requires. And bear in mind that every age group requires a different skin type. Your skin could be oily in teenage years, but it could get dry in your 30s. So it's not that you have the same skin type throughout life.
Exactly, I agree totally with you, because no one product can fit all skin types and different conditions as well. So, Dr. Akreti, from a clinical perspective, how can patients navigate this overwhelming landscape and choose products with the scientific backing for their specific needs?
Now, in today's day and age, there are new products every day, and it's practically impossible to know which product is better than the other. Now, when the patient comes to us, we analyze the skin, and whatever is required in the basic clinical aspect, we prescribe that. But bear in mind that it may or may not suit you. So unless we try, we don't know that it is exactly going to suit you or not. There are telltale signs to say that these 5 products are good for dry skin, these 5 products are good for oily skin. So we generally grade the patient in that domain and start prescribing the most neutral products that are available, and then we take it forward from there.
Perfect, as I expected. Thank you so much for Dr. Akreti for your valuable insight. And this is a start engine in dermatology. So I hope to continue our dermatology series with you. Thank you so much.
Definitely. Thank you so much. It was lovely to be on your show.
It's lovely to have a good day. Thank you. Bye-bye.